Children start to communicate as soon as they're born, right? We're waiting to hear those first sounds, right? They start with a cry. And then children let us know that they're happy with something, with making sounds or smiling, and there's a different sound for when they're not happy with things. And then as they get older, they start to use words to label things, and they are able to tell you that they want a bottle or name the person in the room, mama, daddy. And then they build on those words. They are able to put multiple words together. So these milestones provide families with opportunities to see what's typically expected at the different ages between birth and 5 years. So babies typically don't have any words, but they are communicating. They either cry, they make sounds, they look at things, they gesture for things. Children at age 12 months are really starting to use words to label things. Dog, cat, ball, cup, naming those items. And that's something that we expect to see. Children having a significant vocabulary that they keep building on based on their experiences. That's why talking with children about what's in their environment, giving them the labels, giving them opportunities to name things, is one way that they can really become comfortable and confident with the vocabulary that they're producing. So some children find difficulties in acquiring the developmental milestones or continuing to make progress because they may have a hearing loss, they may have had a significant amount of time that they had middle ear infections, they may have had some type of developmental delay. And if that happens, families should feel very comfortable letting an expert know and having that expert take a look at the child and evaluate whether or not what they're seeing is atypical and whether or not there's some kind of intervention that should be offered. ASHA's milestone checklists are information around what behaviors are expected from birth through age 5. So parents and families can use those as their child continues to grow and learn. And what are the expectations? What are typical behaviors that children at 24 months, at 3 years, at 4 years have, and feel as if they are either comfortable with the progression that their child is making, and if they have concerns, they have examples of specific communication behaviors that they are not seeing their child develop, and they can take that list with them to a pediatrician to indicate that I think my child should be seen by either an audiologist or a speech-language pathologist because there's several behaviors that typically developing children have at this age that I'm not seeing in my child. If a parent has concerns and they really want someone to take a look at their child and be able to evaluate their hearing, how they're developing and acquiring speech and language, they can ask their pediatrician to connect them with an audiologist to test their hearing. They can ask the pediatrician to connect them with a speech-language pathologist to evaluate their speech and language skills. So it doesn't always mean that a child is going to have a diagnosis and need intensive treatment. But getting whatever services they need early is always best, because when a problem is identified early, it makes it easier for intervention to occur.